Here's a patient who was experiencing abdominal pain, and so they got a CT of the abdomen and pelvis with contrast. And we can see here, here's the esophagus coming down into the stomach, and there's a lot of stable lines that we can see here. This is a patient who had a gastric bypass. And the thing that I wanted to point out in this particular patient is we can see that there's a dilated jejunal limb right here. This is actually the efferent limb that's coming down, and we can see the staple lines here. That's usually your jejunojejunostomy, and so you can actually see a loop of jejunum, which is your afferent limb, coming into the efferent limb, and then coming down here and feeding the distal portions of the jejunum. And so this is your gastric bypass. The thing that I wanted to point out, though, is that there is dilation here of the more proximal portions of the jejunum in the efferent limb. And one of the things that we think about is, especially when they've got these staple lines here, is that they can have denervation. And so this kind of floppiness can be seen. But in a patient who's having abdominal pain, if we look a little further, more distally in the jejunum, we can see that there is mass-like thickening of the jejunum right here. Now, the question then becomes, what's causing this? We can see here the plicae circularis, also called the valvula conniventes. That's these kind of linear luminal excrescences into the lumen of the small bowel of the jejunum. And the reason that it's thickened is not because the actual wall of the jejunum is thickened, it's because it actually has an internal mass within it. And so when we look at this mass and we follow it more distally, we can actually see that this is where it goes to the normal jejunum. It comes down to its normal size. But what's actually causing this mass, we can actually see the mesenteric fat right here and the mesenteric vessels being pulled retrograde into the jejunum along with a loop of jejunum. And so this ends up being a jejuno-jejunal intussusception. And since this is occurring in a retrograde fashion, this is called a retrograde intussusception. These can be seen in the setting of gastric bypass and should raise some concern. These can become ischemic and cause bowel obstruction, and so these oftentimes need to be investigated surgically to decompress them. Just to show another example of the exact same thing, here's another CT scan where you can see this dilated loop of bowel here, this jejunum, right at the jejuno-jejunal anastomosis. And if we go more distally to this, we can again see a very similar appearance of what looks like thickening, but here we can see the plicae circularis here coming into the jejunal lumen, and if we follow this more distally, we can actually see it's more subtle than the prior one, but we can see some mesenteric fat and vessels coming in to this bowel loop in a retrograde fashion, and so this is a retrograde jejuno-jejunal intussusception. And so the question then becomes, is this causing some bowel obstruction? It can be a little difficult. It does look like the bowel loops are a little dilated, but again, it can be difficult given that this patient has denervation of this loop of bowel, and it can appear floppy. But these retrograde intussusceptions need to be evaluated surgically.